According to the World Health Organization Global Health Observatory data for 2022, nearly 5 million children died before the age of 5 globally from preventable diseases or conditions such as malnutrition, pneumonia, malaria, and diarrhea. In Uganda, the situation is not any different as both rural and urban children are affected. However, those born in rural areas to the poorest families and with uneducated mothers are most likely to die at the age of 5 and can be avoided if caretakers had access to appropriate healthcare knowledge in addition to other health services. Rose Academy's Fellowship Program is one of the sustainable solutions towards improving healthcare knowledge among the rural poor.
My name is Susan Stassi, and I am the CEO of Rose Academies. The idea of forming a fellowship, I needed volunteers to help me to spread the education message out into the community. I had a wonderful program director. We talked about, would this work? And we put together a program and the ideas of how much time would be invested, would this be a year program, 6 months? What were the obligations of once you decide to be a fellow? And so working together with my program director, as a beginning we learned, and so actually now we are in our second iteration of our fellowship program, and our fellows, it was designed to be a program that would provide a platform for skills development and not only learning how to teach, but giving the skills in technology, research, healthcare. These young adults are proving that given the opportunity, this fellowship is a powerful way of giving youth the opportunity to move ahead, and it's so needed.
My name is Claire Ainomgisha, and I'm the Program Director of Rose Academies in Uganda. The Rose Uganda Fellowship Program is an internship program for young adults in Uganda who are committed to improving the health and welfare of rural families by providing educational guidance on healthy practices and good nutrition. We don't diagnose, dispense medication, or even assume the role of a qualified health practitioner. But our primary objective is mainly to educate rural women about neonatal health, nutrition, menstrual health and hygiene, family planning, and disease prevention so that infants will live beyond 28 days of life and families will have an improved awareness of healthcare practices for healthier lives. How we select our fellows is mostly based on one, they must be a youth and able to speak and read English. They should be passionate about health education and serving their communities mostly, because we look for the youth that are within the communities where we work. And this program is actually inclusive to all persons of different races, religion, sex, and disabilities, because we have so many people that we work with that are persons with disabilities. Our fellows work in 4 regions. Southwestern region, that is in Kanungu district. We have 2 fellows right at the moment. Then the central region, which is in Wakiso district, we have around 4 fellows working over there. The eastern, that is in Buikwe district and in Soroti district, where we are all integrating our educational programs into around 8 to 10 local clinics that serve about 30 or 40 rural villages, and these are about 5,000 rural community members. And in all these, we are teaching about healthcare and nutrition. So the fellows serve for a period of 12 months before graduating. We have had 2 intakes at the moment, and the first group was recruited in June, that is in 2020, and then up to June 2021. Then the second group started in July 2021 to June 2022. I gratefully speak that we have graduated an enthusiastic and knowledgeable group of 20 young youth today. Thank you.
These young adults have done amazing work to save lives in rural Uganda despite the ongoing pandemic COVID-19. Their efforts in teaching mothers how to feed and care for their infants, showing persons with disabilities how to improve nutrition by fortifying porridge, and holding interactive and engaging workshops are changing the way we teach health care to Uganda's rural poor.
My name is Mohamed Regan. I'm a Rose Fellow Uganda. I joined the organization in 2020. Now I have my 2-year working experience with the organization. I have acquired a lot of knowledge concerning family planning, babies care, that is Omana's life, especially in Mbuga village and Chanchere, where we have been doing our trainings, and we have extended far to other sub-counties like Rutenga and Kanungu Town Council, where we are doing our practices. So I have really benefited much. Thank you.
Hello, my name is Bastula Nalwama, Rose Fellow Uganda, working as Wachiso team leader. Personally, I've been able to learn so many things. The best example I can give you is about making the nutriash porridge. This porridge is so good for children who have problems with appetites. It is blended with different components. I've been able to learn how to make it, and I've been able to teach different women in the rural areas how best they can utilize this porridge. Almost all the ingredients we use are very cheap. We've been doing vegetable gardens, encouraging women as well as mothers of children with disabilities how to prepare backyard gardens. We've been doing this to help them to have nutritious meals for their children. Personally, I'm hard of hearing. I have a hearing impairment, and I work with an organization for hard of hearing persons. So as we move in the communities, we try to see how we can encourage persons with disabilities not to despise themselves, because I believe they can be like me, they can be trainers outside there, to think about the value of trainings, the value of knowledge, because as Rose Academy, we empower through education, and we believe that's how we are going to change people's mindset. Thank you so much.